and entries made after this time won't be counted but may still be charged. Best of luck.
Now, we are talking about obsessive-compulsive order now. Who does it affect? Because this week is the start of OCD Awareness Week. And in the studio now to tell their story, Georgia Flower and her daughter, Dee, they both suffered severely from the condition, and cognitive behavioural therapist Katie Dath. Katie, before we find out the stories of Georgia and Dee, if people say, well, OCD Week, that's nothing to do with me, I'm not affected by this. What do you think? What do you say?
Well, ultimately, OCD is a pretty prevalent disorder. They reckon about 3% of the population suffers at any time in their
How many?
life. About 3%.
3%.
I mean, the figure varies a little, but...
Yeah.
So, and it comes in lots of different guises. And generally, it's characterised by having unwanted, intrusive thoughts that you find troubling, and usually accompanied by some kind of compulsion.
Right. Well, wait till we tell people the story now of Georgia here. Georgia, your compulsion was what?
It was called trichotillomania, which is a situation where you pull out your hair to release a form of tension, which builds up.
Just ask you, when you say to pick out your hair, are you talking about one strand at a time?
Well, I think it depends on the person, really, but for me it was one strand at a time, and it was like pulling a plug, which released this tension temporarily. It was
well,
just...
it was literally pulling a plug.
Literally pulling a plug.
From your point of view.
Yeah.
When you say one strand at a time, how many strands a day, a night?
I could go up to 200 strands a day.
And would you save them up? Could you actually look and see what you were...
I would never save them up, but you could see there was evidence.
And do you know why? Can you remember a moment when you first did that and why you did it and how it felt?
It was a euphoric feeling. It was just an amazing feeling of, like, I have now got a tool I can use to relieve myself of this tension. And I don't know why I have it, and I don't know. I didn't know what was wrong. I just...
But George, you say euphoric. Are you saying to me it's euphoric pulling one strand of hair, or is it euphoric pulling 500 strands of hair? Where does the euphoria kick in for this? The one. One, literally one. You felt good. And then was there, I suppose it's like people who overeat or scratch themselves or something, do you then come down from that euphoria and feel bad about yourself?
Hugely. It's a huge low. It's, you know, two ends of the spectrum. So you have that euphoric moment and then you come down, and that's why you need to repeat it 200 times in the day, because you need that permanence.
This was all happening when you were just 12 years old. So were you aware that any of this was happening to
When Georgia was 12, we noticed her hairline changing. Yeah. Beauty of the internet, I went on the internet and googled child hair loss,
But when you say her hairline was changing, where was she pulling this from?
At the time it was up here. That she had her hair tied back, and you could see the line here. Yeah. But you did quite a lot of damage down the centre of the head, and it becomes very obvious.
Did she admit to pulling it out at that point?
Eventually, when it took a bit of persuasion, I think, to get her to.
Now, here's another interesting twist in this whole story. So, as a parent, you go, "Oh my goodness, this is terrible. Why is my daughter doing this? This is ghastly. What possibly could be behind this?" And you want to cure and find a reason for all of this. Not only did you find a reason, you then found a connection.
I did, because the condition of pulling your hair out is called trichotillomania. It's got a sister illness called dermatillomania, and that's where you attack your skin until it bleeds. And again, it's the same thing. You want a sort of sense of release from some sort of tension.
Attack it in what way? Like
just
scratch
it until it bleeds.
Which is what you did throughout your life, or when you were young?
I'd done it from about the age of 16. And I was still doing it at the time that Georgia's hair was being pulled. And really, you know, one of the reasons we came here today was we wanted to say that because we found each other, we understood each other, we started talking, and in talking, we started the healing process. And actually, you know, to this day, we do not do it anymore. I don't attack my skin.
You stopped completely. Yeah, so what sort of treatments, Katie, are there that people could have to stop them?
Well, talking therapy and cognitive behavioural therapy is the most common treatment, and I think you both had lots of talking therapy and found that incredibly helpful. I think the thing that the primary issue with any of this, as Dee really explained very well, is that, you know, she had this problem for years and years without realising that it was a problem that she could get help for. And that's what a lot of people experience. Usually it's about 10 years from onset to diagnosis for most obsessive-compulsive spectrum disorders.
And is there any connection that, you know, that Dee had it and then her daughter has it? Can you pick up a stress from a parent? Or...
Hereditary.
Yeah.
I think there's not necessarily evidence that it's hereditary as such. Certainly, you know, behaviours can be passed on and copied, but it's probably more likely to be a personality trait that they share. So it's not necessarily that, you know, even if they'd never met each other, they might still have the same.
I could see the joy
condition.
with you there, Dee, when you actually said we healed ourselves, basically. You talked to
Not
each other.
without help.
Yeah.
Not without help. We had a huge amount of help.
But there was obviously a special bond created between the two of you. How comforting was that for you, Georgia, to realise I'm not alone in all of this, and one of the people I love most of my whole life totally understands what I'm going through here?
I think I am one of the incredibly fortunate people to have that, because I know a lot of people don't. And to know that my mum, out of all people, was the one person that I could look for comfort and look for understanding, and I could talk to her and I could be heard by her, and that was such a blessing to me.
Could I ask you, without being too intrusive, and I don't want to know if you don't want to tell me, but were you able to identify, and can you talk about what the underlying reason was for all of this emotionally?
I don't even know that there was an underlying reason. I think it was just something within us. I mean, Georgia, yes, it was spotted at 12, but she'll say that it was a lot earlier that actually she knew that there was these sort of slightly compulsive urges within her. People have asked me if there are reasons.
Katie, as well, you know, OCD to me, I think of people washing their hands 50 times or going back in 20 times to check you've switched the gas cooker off. I had no idea that it could be physical, of pulling your hair or scratching your skin. Is that quite a common symptom?
So officially, this isn't actually OCD, it's an OCD spectrum disorder. So they're basically the same kind of family, so it's like OCD's cousin. So what you're talking about, the hand washing or the repeated behaviours of checking, that's your more sort of standard OCD itself. And these are standalone disorders in their own right, but they share a lot of common kind of properties. The big difference is that what Georgia and Dee described really beautifully was that for them they get the urge, and then in the pulling or the skin picking, you actually feel kind of, there's almost a pleasant feeling. There's a release of tension and there's almost a pleasant feeling. Whereas in the kind of OCD that you describe, generally when people are performing those kind of compulsions, you don't get that pleasant feeling. It's about warding off threat. It's about trying to kind of reduce anxiety. So it's slightly different. But
it is complex.
There's help for all of the spectrum as well.
There's help for all.
And that's what this Awareness Week is all about. Good luck with it, and we should say to you two, good luck with the future, and I hope it all ends up okay. And what a marvellous head of hair you have. It's incredible. It is incredible. You get that from Mum as well, I say.
And if listening to that has made you think maybe somebody you know, or even yourself, you're worried about some of your behaviour, anything we've discussed there, we have got details of helplines. As Katie said, there's lots of help out there. That's all on our website, itv.com/This Morning. So have a look there.
After the break, my two favourite boys, Sam and Mark, they're going to be getting hot and sweaty fitness